The South African Medical Association trade union has expressed deep concern over the escalating crisis of qualified doctors who remain unemployed after completing their community service. Ahead of President Cyril Ramaphosa's SONA address, SABC News reporter Nhlamulo Mabaso spoke to some of those unemployed doctors in Mpumalanga.
As we are preparing for the State of the Nation address ahead of the President's address this evening, we are going to welcome some of the doctors, or rather unemployed doctors, or to hear their plight as to what is it that they're expecting the President to talk about or to say ahead of the State of the Nation address. And we are welcoming Dr. Manda Matsabe, who is speaking on behalf of the doctors who are not with us at the moment, just to talk to us as what it is that they are expecting the President to say this evening. Good morning and welcome to our show.
Good morning and thank you for having us.
What is it ahead of the President's State of the Nation address this evening? We know your concerns as doctors. When we go back, just to remind the viewers at home, let's go back to your concerns.
Yes, primarily our concerns were based on the high unemployment of the youth in the country, specifically focusing on the high unemployment of healthcare professionals, that including doctors, nurses, dentists, physiotherapists, pharmacists, and the whole allied healthcare professionals. And one would remember that on the 17th we embarked on a march to demand government to give post to these healthcare professionals because we are on the verge of NHI, and NHI by nature needs healthcare professionals. So we were saying as a union that we cannot have a rollout of NHI when we are having staff shortages in the hospitals. So as an attempt to get to that, we did the march. But now we are expecting the President to speak to that, because the high unemployment amongst the youth is what is contributing to the high unemployment of healthcare professionals. It is not only us who are affected, it's the broader scope of the youth in general. We are hoping that the President is going to speak to that and address matters of high cost of living, the issue of load shedding that has come back, amongst other things that are pertinent at the moment. But one would understand that the doctors are unemployed, are sitting at home with their degrees ready to serve, but government says they do not have a budget. So we are hoping that the President is going to address that, because as defined by World Health Organization, health is a state of utmost biopsychosocial well-being and not merely the absence of disease. But in this case, we understand that our doctors who are unemployed might not have the presence of disease, but they are not defined as healthy on the basis that their psychosocial aspect of the definition of health is being affected. And we are running a risk of basically having a vicious cycle wherein our doctors become mentally too pressured because of the psychosocial aspect that is affected, and running into a vicious cycle of hurt people, because we need the healthcare professionals to be the ones that are healthy in order for them to promote health, prevent diseases, and treat diseases. So at the moment, we are hoping that the President is going to speak to that and give a clear directive to the Department of Finance and the Department of Health to employ these healthcare professionals and strengthen the systems so that the rollout of NHI can be successful and the majority of the country can benefit. Majority of those who go to the public healthcare institutions can benefit from the NHI as a whole.
In terms of numbers in the province, where are we sitting in terms of unemployed doctors? And also, as you answer or rather tackle that, have you lost all hope in the provincial government, or rather the Department of Health, as we saw you protesting just a few weeks ago, raising your plight?
No. I think I'll start with the latter. We've not lost hope with the Department of Health. I think the Department of Health, or the leadership of the province as such, one would understand that our demonstration is to actually say that we still have hope in you. When we lose all hope, we are going to sit down and say government at national level must come and intervene at this province. But no, we have not lost hope. We've had successful engagements even with the Office of the Premier after our strike, and there are some commitments or resolutions that have been taken, and we are only awaiting for provincial government to give us all of those commitments in writing. At the moment, we are sitting at a list of 78 Mpumalanga born and bred doctors who are unemployed, 58 of those which are bursary holders and have a service obligation with the Department of Health. And one would know that in the country as a whole, we are sitting at above 8,000 doctors that are unemployed, and amongst them that we have to consider that we have dentists around the corner, we have physiotherapists, we have nurses, we have pharmacists who are also unemployed. So the staff that is employed now is overburdened, is overworked, and we do not meet the minimum requirement of doctor to ratio patient, which is 1 is to at least 1,000 for a country that is doing good. We are currently at 1 is to 3,300 plus. One doctor has to service 3,300 plus patients, and that we are saying is unacceptable. So we are hoping that the president's address is going to address such things, but also de-escalate to the level of the SOPA when it comes to say that the Premier as well is going to speak intentionally to those issues and ensure that we do not have qualified professionals sitting at home, qualified professionals taking to the street at the expense of the marginalized, the poor South Africans who need to come to the hospitals and receive healthcare services.
Thank you, Dr. Masawe. There you have it, studio, there you have it. All they want is just employment of the doctors. That is some of the plights, or rather some of the expectations that they're expecting the president to announce on this evening.